part of my role as the civil chief of the DA's office is to do all of the mental health cases that come through Judge Franklin's court. So anytime there is a civil commitment that occurs, it goes through our court. That means that it comes through UT or Christus, and then it'll pass through the commissioner, through the county court, and our office and my office and myself will try those cases before Judge Franklin. We have typically on a week 2 to 3 of these cases a week that come through our court that we have to deal with and that we have to handle. That does require some evidence sometimes to be put on. So we have law enforcement officers, family, medical representatives who testify at hearings that we have. And so those cases happen, typically they start with law enforcement. And so typically law enforcement will come in and they will do what's called a POW. I'm sure some of y'all have heard about that before, or an EDW, or there's many different ways to say it, but typically law enforcement will get a call out and they'll respond to somebody who's in crisis, and they'll, instead of taking them to the jail, they will take them over to either Christus or UT in one of the hospitals, and they will begin the process of the civil mental health commitment. And so we work with our partners in law enforcement. We work with our partners at the hospital throughout the year, all the time, on a constant basis. We're in constant communication with UT and Christus staff, and we work together to ensure that, to the best ability that we can, we will help those individuals who are in crisis and get the help that they need. Sometimes they don't want that help, and that's why we do the involuntary commitment. A lot of times it goes through the voluntary commitment process, and there's a statistic that I want to put out there that when I give short talks about mental health is, you know, it is more prevalent than you think. Statistically speaking, 1 in 4 persons has some form of mental illness. Depression, bipolar disorder, seasonal depression, TBI, something that is out of the DSM, the Diagnostic and Statistics Manual, that is a mental illness. Of those 1 in 4, another quarter of those individuals have a severe mental illness, schizophrenia, bipolar disorder, or some sort of mental illness that affects their ability to function independently. And that's when we get involved with that small number. In Smith County, it's about 14,000 people at some point in their lifetime will have a mental health crisis where they will need some sort of psychiatric hospitalization. And then they come through the commissioners, through the county court to receive those commitments. So that's a little bit of background on the civil commitment process. But what I really wanted to focus on today is to talk about the partnerships that we've created here in Smith County with our local mental health and our local healthcare providers. One of the things that the county has done here in the past couple of years under the leadership of Judge Franklin is the Commissioner's Court has directed more funding to mental health programs, and that's direct funding from the county. So we work with our partners over at the Andrews Center. Are y'all familiar with the Andrews Center? The Andrews Center is our local mental health authority, and they provide mental health services to individuals within I believe it's a 5-county region. So Smith County is one of those 5-county regions. So we have increased our funding and resources in these past 2 budget cycles to go to the Andrews Center. We have partnered with UT Health and the medical school and the UT, the main campus, to increase our jail medical care in the jail, in the Smith County Jail. So for the longest time, we had private providers who provided health care, including mental health care, in our Smith County Jail. And here recently, in the past couple of years, we decided to move in the direction of working with UT to contract for that medical care in our Smith County Jail. And that has been an amazing process for us. We have seen the levels of care go up dramatically with regards to mental health and even traditional health care inside the Smith County Jail. And so that is a fantastic partnership that we hope to continue forever into the future, for however long we have the Smith County Jail, which will be forever. because that's our responsibility. We work with Christus. We've worked with Christus on several, I think for the past maybe 8 to 10, excuse me, 8 to 10 years on what's called the LPPF. Is anybody familiar with the LPPF and what that is? I didn't think so. That's a very nuanced program. There's a federal program that passes funds from the federal government to the state to cover uninsured individuals. And Christus came to us several years ago and several hospitals here locally, and they said, hey, we need this funding from the federal government, but the only way that we can do it is if you assess a fee against us. And so the Commissioner's Court said, absolutely, we'll institute a fee for you. If you're asking us to do it, we'll do it. And they draw down these federal funds so that they can pay for some of the indigent health care, and that includes some of the indigent mental health care. We've collaborated here recently with UT Health and with the Andrews Center, and we now have what's called a jail navigator, as well as a mental health peace officer and other staff in the jail who work with inmates to transition out of care from the jail into the community. And that has created leaps and bounds ahead of where we were 3 years ago with regards to mental health care in the jail. The jail navigator also works with our what's called forensic mental health commitments. So if you're not familiar with that process, what that is individuals who commit a crime, but they have been deemed incompetent to stand trial. They have to wait for a hospital bed. Those hospital beds are funded by the state. That wait is up to a year. And these individuals, before we had these programs, would sit in our jail costing hundreds of thousands of dollars a month while they're waiting to go to the state a hospital bed. Well, when we partnered with UT and with the Andrews Center, we thought there's a way to fix this, and so we instituted what's called the Jail-Based Competency Restoration Program. When we started this program, we had about 70 persons who were waiting some of them over 2 years to go to a mental health facility, a state-funded mental health facility. We got that number down to a little under 30. There's a few more that have been added, but we've worked with the Andrews Center, we've partnered with UT to get that number down. And these are the highest level care individuals who are required, the highest level of care is required in the jail. So it costs the most for us to care for these individuals because they're so sick. And finally, one of the things that we've done here recently is we allocated $4 million of our ARPA fund, our federal funds that we received, to UT Health to partner to reopen the Behavioral Health Center here in Tyler, Texas. I don't know if y'all are familiar with this, but the Behavioral Health Center in Tyler, it's over by UT Tyler, had shut down for a little while, and so they are, I believe, if I'm not mistaken, I think they got appropriations from the legislature to move forward with revamping that and redoing that facility. So we will have more beds in Smith County. We will have more crisis beds available in Smith County, and we are happy and glad to partner with UT on that program to offer those ARPA funds that we had available. And by the way, if we don't use those funds, they go back to the federal government. So we need to use them here, and we want to have them here locally. There have been a lot of great things that Smith County has done. I know you've seen it from the parking garage to the new courthouse that's going up. If you haven't been downtown, go check it out. It's really cool. You could sit there for hours and watch them do the work. I mean, we're on, I think, store level number 4 right now. So, but those are just a few of the things that we've done, but I'm most proud of what we've done with regards to mental health and the mental health care, because we have gone leaps and bounds above where we were even 5 years ago. And it wasn't because nobody was trying, it's just because the community is showing that this is what we want. And so we want y'all to continue to show us that this is what we want one of our priorities to be. And also, I'm going to give this statement out there, because I do it every time when I talk about mental health. Talk to your legislature. Your legislature, your state legislature, funds mental health programs statewide. The more they hear from you guys, you business leaders in the community, about this is an important thing that we need to discuss, or this is an important thing that we need to fund, the more that they will be willing to fund those programs. Because we can't do it all on our own. We have to have help from the state, and we have to have help from the legislature. So thank you all very much, and I appreciate you giving me a few minutes to speak.
Good afternoon. It's good to be here with some of my friends from Lindale, Dr. English and his group. It's exciting. And I get the opportunity to sort of brag about what Christus is doing. I don't know the exact number, but I think it was probably 20 to 25 years ago when we broke ground for our clinic. And when our executive vice president bought that piece of property, he says, do something with this. And we were looking at that, and a number of us were saying, what are we going to do with all this property? Nowadays, we're asking, where can we find some more property? Healthcare in East Texas, and I know my UT friends would say the same thing, says, where do we find more places to build, to put stuff, because there's a demand for healthcare. So I'm going to talk to you a little bit about our clinic and as far as what's going on there. Our healthcare clinic now, we have our emergency room, which stays busy all the time. We have primary care, we have internal medicine, we have 3 pediatric physicians now, we have medical weight loss there, we have cardiology that comes there, orthopedics, sports medicine, and then on the other end of the building, we have our fitness center. I would ask everybody how many people have joined the fitness center, but we have 3 clinics, actually 4 clinics, that have a fitness center in there. And they're open 24/7. 4 of the 5 have a 25-meter pool in there. And one of the things that we've learned about having that pool there, that we've attracted a new population of customers. The older adult, the ones that have suffered from sports injuries, arthritis, that type of thing, and they have found we can get in the pool and we can do things we haven't been able to do. And so it's been a great thing. We have physical therapy in that building. We have scheduled classes in that building. We have trainers in there that can work with you. But anyway, that's been a part of our whole operation, is to promote wellness. Not just to take care of illness, but to promote wellness. And that's something that we're really looking forward to. As far as our health system, we just keep expanding. We've just almost completed our 11th ER in the primary, secondary, and tertiary markets because there's a demand for it. And a lot of it had to do with the increase of growth in East Texas. As you know, East Texas was voted the #1 place to move in the state of Texas. And it had to do with infrastructure, which is the people that manage our cities and our counties. It had to do with medicine, and it had to do with education. And we've got it going on as far as those 3 are concerned. And I would also put on there that it's also because of lifestyle and quality of life. And I might even add Chick-fil-A and the candy store over here. They're second to none. But anyway, it's so we're looking at an opportunity to grow our services in every area. Since the last time I was here and talked to anybody, our pediatric services have just grown out the roof. We have pediatric surgery, we have pediatric GI, and endocrinology services that we just haven't had here before. And our oncology program is growing. Let me stop right there. I wanted to introduce one of my new doctors. This is Dr. Ciara. She is a new doctor of psychology, and she will be working. She heard about us in Poland and made her way here as quick as she could. Please go by and say, howdy, ma'am, and welcome her to East Texas. You will enjoy meeting her. A couple other things I want to, anyway, we keep expanding, and yes, the psych services and our behavioral health is a big demand for all the healthcare systems, and we're trying to do our part to be a part of that solution. We have residency programs in Longview. We're starting a a new program that we've never done before, and with A&M, to teach about rural medicine. And there's a lot of people that want to go into rural medicine because if you're a rural medicine doctor, you get to do a lot of different kind of medication and service. And the last thing I would talk about, because I get this call all the time, what about the medical school? How's that going to work for you? Well, no sooner had UT announced that, and they called me. And they said, we want to do something for our students. And so every other month, we have a student career social. And the idea of that social, we meet at Willowbrook Country Club. We invite physicians from 3 of our specialties. UT does that. The whole agenda for that evening is the students talking to the physicians. Why did you become this type of doctor? How do you practice medicine? What have been the ups and the downs? Guess who gets the most out of that? The doctors, because they get to talk about what they do. And I look forward to that every month. As a matter of fact, we're going to be meeting this time at the Tyler Museum of Art. So we're trying to give them more exposure to what's going on in East Texas. And because for both health systems, one of the things that we hope to get out of the medical school, our residency programs, is to attract these young doctors back to East Texas because the population growth just demands that. So I thank you for the opportunity. Be glad to answer any questions at some point in time about what's going on. And if you need a doctor, I can help you with that as well. Thank you.
Always hard to be the third speaker after lunch. Hopefully y'all aren't feeling too bad about that. Make sure you can hear me okay. Hey, last time I've been out here at a hideaway, I think it was about 15 years ago, my kids were participating in a hideaway triathlon. Y'all still have that out here? Does it still happen? No? Never? Yeah, I heard that a long time, but it's a beautiful place, and I love Lindale, Texas, and appreciate the opportunity to visit with y'all today. And I think the theme of my message today is going to be about, is this now on?
They can't hear you.
I'm so sorry.
Let's see if we can.
No.
Oh, perfect. We want to make sure they can hear you.
Yeah, I think the theme of the message today is about partnership, and it's about collaboration. And we're really doing some amazing things related to partnership in mental health, and as well partnership with Christus Health System and many other community providers in terms of what are we doing to impact the health and the lives of people of Northeast Texas. And that's why we're all here today. As business leaders, as governmental leaders, we're here not just for the economic enrichment of our community or ourselves or our businesses. We do that, but for the benefit and the good of the people that we serve in this community. So I did want to just start with a verse from Scripture that we all, I think that many of us would resonate, from Philippians 2, verse 4. Let us each look not only to our own interests, but also to the interest of others. I think that's why we're here. And that is something that we share, so many of us, and with Christus Health System, with my own personal beliefs, and with UT Health, and as well with the School of Medicine. Shared interest in what we do to improve the quality and the lives of the people in Northeast Texas. So, Steve Cox, I'm a practicing general surgeon. I've been here in Tyler, Texas for about 28 years, all with UT and the Health Science Center. So I thought I might share just a really brief, interesting story about UT Health, as you know, and about UT Tyler. You all probably know this story, but it's a fascinating story of progress and of impact for our communities, and really things that have happened since 2018. As you know, UT Health Science Center has been around for more than 50 years, since the 70s, even before that as a TB hospital. When I came here to Tyler, I got to work with those patients who had advanced tuberculosis up at the Health Science Center down the road. So we were a healthcare provider in this community, along with Christus and ETMC. We found ourselves with a pretty small footprint overall in terms of clinical care and our ability to reach a population. To reach a population to improve the quality of care, and also to provide training programs for future physicians. So as we've always had very strong programs here in family medicine training, in occupational medicine training there. We started a psychiatry program about 10 years ago because we understood the community needs in behavioral health, as you indicated. So many do personally suffer from mental health and behavioral health issues, and it impacts so many of us, even in my own family. So we understand the important need to develop that service. We've been doing that for many, many years. However, we wanted to see how we could increase our impact in this community. And we had an opportunity when East Texas Medical Center had announced that they were putting themselves up for sale. A fantastic organization that served the community as a public hospital for so many years, impacting the health and lives of this entire community. But we found ourselves with an opportunity that presented itself to us in terms of the potential to purchase ETMC. We at the university, we're too small to do that, right? As a relatively small academic health system just down the road. So we found a fantastic corporate partner in a company called Ardent Health Services. Ardent Health Services is a company out of Nashville, Tennessee. They at the time had about 20 hospitals that they managed in their hospital portfolio. So we partnered with Ardent Health Services to see if we could potentially purchase a health system, which was called, as we all know, East Texas Medical Center. That deal was successful. It went through and came to fruition in 2018, not too many years ago. So that then gave us the opportunity, right, to have a clinical footprint and a foundation to build not just clinical service across the region through the vehicle of UT Health East Texas, but also then to greatly expand what we can do in terms of what we call graduate medical education, residencies, where we train doctors after medical school to go on to complete their training, and then also gave us the platform and foundation to think about the creation of a new medical school. And that's been the aspiration of so many, Dr. Kirk Calhoun and others. Kevin Eltife couldn't have done it without him, and so many others, the community support, Christus, and so many others that allowed us to make this happen. So with that, another interesting aspect of this is that we may not know that the proceeds of the sale of a public company like ETMC have to go to the public good. So many of those proceeds went to the ETMC Foundation. ETMC Foundation saw the need for a school of medicine in this community and decided to donate about $80 million such that we could then begin to start the planning process in terms of the School of Medicine. So without that gift from the foundation and other community support, we wouldn't be here today. So fantastic opportunity. With that then, we're able to begin all the planning phases, put together the School of Medicine that we did finally put together in just a couple of years ago. So we in the School of Medicine now are in our second year of the School of Medicine. We've already accepted our third year class. It's a relatively small school, 40 students per class, and we do expect that class size could grow over the years. But right now we're at 40 students per year just in our second year. And it's been an amazing journey throughout that. So we talked about our health system partnership in UT Health East Texas, and that has given us the clinical foundation to really build our training programs throughout Northeast Texas. We have to have places where our students and where our residents can train. So it's been very important as we build upon the 9 hospital system throughout Northeast Texas, and now more than 100 clinics throughout Northeast Texas, where our students and our residents can serve and learn to practice medicine. So we've seen amazing developments in the healthcare landscape here in Northeast Texas in a very short period of time. In addition, with UT Health East Texas and the new academic health system that we are creating, we're able to bring new specialties and new expertise to Northeast Texas that really have never been seen here before. And that's really, I think, part of the value that an academic health system can bring to a region such as this. I can highlight so many examples of this and things we've done in recent years, but one recent example in development of how we can bring the latest technology to patients is, say, a program that we put in place beginning last year in October, a program called ECMO. Have you ever heard of that before? ECMO is a program that relates to how do we assist patients who have lung failure or heart failure. It's extracorporeal membrane oxygenation. So you might have heard throughout COVID, people with advanced pneumonia may have needed to go on life support, something called ECMO. So it's a life-saving procedure where when people have respiratory failure or heart failure, that we can sustain life until as a bridge to other treatment modalities. We started that in October of this past year, and we've actually had about 19 patients who have benefited from that ECMO process in that short period of time. And so we've made major advancements in terms of cardiac care, and advancements in cardiology in general. So again, our commitment to Northeast Texas is to bring the latest in advanced medical care to our communities. We're expanding care in terms of primary care with the recent development of 6 new urgent care centers across the region. Excited about that. We made a major commitment toward women's health and women's health services. Part of our new academic medical school building on the Beckham campus will include more than an entire floor that's devoted just to women's health services, with a state-of-the-art imaging center for women in that clinic. We know that breast cancer affects at least 1 in 8 women in this country. And what we find in Northeast Texas is many women do present quite late in the course of their disease. There's a much better prognosis if we can find and detect those breast cancers very early. And we really hope that this center will help us to expand access to care with the latest and the state-of-the-art technology related to breast cancer and breast imaging. That's going to be part of the new academic medical center and medical school building that we're currently underway at the Beckham campus. So we talk about growing and building the resources here for Northeast Texas in terms of training doctors, but it's more than just a medical school. Y'all may not know that we go to medical school for 4 years, but after that, most will then have a residency training program in a very specific discipline. So it's not enough if we're going to keep people in Northeast Texas to live and practice here. We also need to provide them these residency training programs so they can complete their education, hopefully locally, and then stay and work in Northeast Texas. That's been our goal. So back in 2018, we had about 3 training programs, as I mentioned: psychiatry, occupational health, and family medicine. And we've been able to expand those residency training programs to more than 20 programs today, from 30 residents in training about 7 years ago to more than 230 residents and fellows in training today, in addition to the brand new School of Medicine. So there's so many now, I had to make a list of the disciplines that we're now training doctors in for those 230, but it's actually quite incredible the progress that we made. Family medicine, as we talked about, occupational medicine, psychiatry, where there's such a great need, child and adolescent psychiatry fellowship as well, internal medicine. My specialty is general surgery. We started a general surgery training program just under 5 years ago. We'll be graduating our first surgeons in general surgeon here this month. Preventive medicine, sports medicine fellowship, a brand new anesthesia residency training program, a cardiovascular fellowship, a hospice and palliative care fellowship, gastroenterology, pulmonary critical care, hematology oncology, nephrology, neurology, interventional cardiology up and coming, and then plans for other program developments where there's a great need in terms of pediatrics, OBGYN, and other disciplines. So that's just a short list of the brand new training programs we're putting together to train new doctors, to bring them to Northeast Texas, and hopefully they will live here, stay here, and work here. Now, part of the way that we recruit students for our School of Medicine is actually quite unique. Not only do we want to attract the brightest and the best, and we have done that in terms of grade point average and medical college aptitude test, right? We want the best qualified students, but we also look at students as they apply in terms of where they're from. And what we've been successful at actually is recruiting students from Northeast Texas. More than 85% of our students in our first 2 classes have ties to or from Northeast Texas. And we do expect that they train here, they go to medical school here, they complete their residencies here. More than likely, they'll stay here and live here in Lindale, Texas, and Northeast Texas, and really serve our communities. Again, to improve the health and lives of the people in Northeast Texas, that's why we're here. So excited about our training programs. As you know, we have a new School of Medicine building coming up down the road. It's about a $308 million project, and 250,000 square feet for clinical space that's important in our educational programs, and that will house our School of Medicine, as most of that is currently on the North Campus today, and that will shift to the campus on Beckham beginning later this year and into the following year. So very excited about the new School of Medicine, what that represents for our students and our training programs. You know, when we think about Lindale, Texas, even though I'm not from here, I don't live here, but I think a lot about Lindale. And you hear a lot about Miranda Lambert, I guess. Pretty important person, but a lot of famous folks from Lindale, Texas, right? And I thought about a few, like Paul Beloche, Dallas Home, I used to listen to Keith Green, I guess not Lindale directly, but Garden Valley, if you're a Keith Green fan. As well, Pat Mahomes Sr., I guess, from Lindale, Texas, if I understand that correctly. But what we expect is we, UT Health and UT Tyler, we have a commitment to Northeast Texas and to Lindale, Texas. Not only in bricks and mortar, but also in training the next generation of providers for our children, for your children, for your grandchildren. And it's amazing the opportunities that we will be able to provide for future generations, not just in our School of Medicine, but now with the affiliation of the UT Tyler General Campus, now with the Health Science Center, offering so many other programs, and not just in healthcare, but in this case in healthcare in terms of our College of Pharmacy, our School of Nursing, Speech, Language, and Pathology, and other programs we're putting together. You may not know that we currently have enrolled about 2,800 nursing students on the UT Tyler campus today. Nursing is in such demand across the state and across this region, so we're very proud and pleased to be able to offer that training for the workforce of the future. So incredibly excited about that. But another Lindale native, Ray Perryman. As you know, he's achieved probably international reputation in terms of his economic forecast. And so I thought I would just even quote from his report from the Perryman Group about the UT Tyler School of Medicine and its economic impact in this region. And his group says that the UT Tyler School of Medicine is expected to contribute about $183 million annually to the gross product and support about 2,118 jobs in the Tyler metropolitan area. Over the next decade, the cumulative effect of the medical school's operations, expanded residency training programs, and retention of graduates in the region could result in an increase of about $1 billion in annual gross product and a creation of, again, more than 10,000 jobs within this community. So the School of Medicine has a dramatic impact, I think, on our communities, on the quality of care that we provide to people, improving access, improving the quality of health, and also giving people opportunity to serve throughout a region and truly improve the quality of health care. So I think the School of Medicine and UT Health, we'll do a lot in terms of its impact on our region, including Lindale, Texas, in terms of population growth, as we've discussed. We expect that we'll continue to attract more students, more residents, more physicians who will live, work, and train here. And I think that will lead to increased demand for housing, for local services. And I can tell you, every time we bring a new doctor to town, I always talk about Lindale, Texas. It's a great community just up the road, not too far from the hospital. And it is truly a fantastic place to live. And I think we'll see that influx in all of our communities throughout the region. Enhanced access to health care, not just mental health services, but throughout. I think that Northeast Texas and Tyler in particular will continue to be seen as a major hub and destination center for healthcare services. And that's really not because of what we've done in a very short period of time at UT Health and the Health Science Center, but our success is really built on the success of so many others. Our great community health providers, it's based on the success of Christus over so many years. And again, Christus has been just a fantastic partner with us, as well as they have provided to us training sites for our students and for our residents. And so that collaboration will continue. And I think that's how we will continue to build in the future based on those partnerships. So really excited about the future of UT Health East Texas and the UT Tyler School of Medicine. And if there are any questions, happy to entertain those.